Hi, my name is Dr. David Gifford. I'm the Chief Medical Officer at the American Healthcare Association. And Thank you all for joining us for this discussion about how to deal with the respiratory viruses coming up this fall, not just COVID, but influenza, RSV, and all the other respiratory viruses that we know spread around this fall. Kicking off today's session is Dr. Ashish Jha. He is the COVID coordinator for the administration. He is the former dean of the School of Public Health at Brown University, is a physician with a background in public health, and really many of you have probably seen him on TV giving out really sage advice on what to do. We've had some conversations with him about the importance of what we can do to really decrease what we tend to see every year when these respiratory viruses spread around, and now we have COVID added into that. So let me turn it over to Dr. Jha to give some of your points and wisdom that we so value. Thanks.
Well, Giff, thank you, and hey everybody, thanks so much for letting me come and spend some time with you. And I'm gonna assume you all can hear me okay, and somebody will let me know if not. So as Giff said, look, we are obviously in the thick of the holiday season, the winter season, and what that means is we are seeing across the country 3 major respiratory viruses at very high levels. You've all heard about RSV. People talk a lot about RSV in kids, and it's true, kids under 2, they're the main ones who get into trouble. But we know that older folks can actually get into a lot of trouble with RSV as well. Influenza, always a problem this time of year. We are seeing right now the worst flu season of the last decade. I mean, and we are not anywhere near its peak. Influenza is still rising. And then COVID has started increasing in the last 3 weeks nationally. It is increasing in about 90% of the country. Nationally, cases are up about 50, 60% just last 2 weeks. And hospitalizations are up about 20%. And y'all know that hospitalizations always lag and they follow. So all of that, of course, has all of us concerned about 2 sets of issues. One is we're just going to see a lot of people getting infected and sick. And second, that we're going to see a real strain on our healthcare system and the ability to manage all of this. So I've been really pleased and just delighted. We have spent a bunch of time with the leadership of AHCA. Really pleased that we've been able to engage and think through what needs to be done to protect our residents, what needs to be done to get through the next couple of months without a lot of folks getting extremely sick. And the strategy here is a 3-pronged strategy. And again, the partnership here with AHCA and working with us has been just terrific. I know a lot of you have been working on this, and we see nursing homes and other extended care facilities and long-term care facilities doing a terrific job. There are dozens, if not hundreds, that have gotten more than 90% of their residents the updated bivalent vaccine. That's extraordinary. But of course, we also know there are other nursing homes that are struggling, that have relatively small proportion. And we want to think about how do we be helpful on this front. But let me just talk about that 3-pronged strategy, put it all on the table. And then one of the things that I'd love is either now, or if you want to give feedback to Giff and the rest of the AHCA team about things that you see as barriers to achieving those goals. We're happy to work with CDC, is happy to do this, CMS is, to work with AHCA and Leading Age and others to try to make sure that we're actually delivering and making and addressing those barriers. But let's talk about those 3 things. It all begins with vaccinations. Making sure every single resident and ideally every single staff member is vaccinated against both COVID and flu. Now, I understand a lot of people are like, well, do I really need another vaccine? I got one last year, or I got one 6 months ago. 2 sets of issues. We do see waning immunity, particularly in older and high-risk Americans. And second, that the version of the virus that's circulating out there is very different than what it was a year ago, and even quite different and far more immune-evasive than what we saw 6 months ago. So a vaccine from 6 or 9 months ago is just not going to provide the level of protection that we need. Just as we don't say, well, I don't really need a flu shot this year because I got one last year. It's sort of the same thing. There's no like, I don't need a COVID shot this year because I got one last year. If you've not gotten an updated bivalent vaccine, it's critically important for everybody, but particularly for people over 50. Second part of this three-pronged strategy is making sure that people are getting treated if they have infections. And of course, treatment comes with testing. As you all know, the Biden administration has been very committed to making sure that we're getting tests out to nursing homes. I know that there were some glitches on that, but let me just be very clear. Our commitment on this issue is unwavering. We think nursing homes and other long-term care facilities are really important places for doing testing. We're going to continue making sure testing is getting out. But when those tests turn positive, people need to be treated. And we have great treatments. There are a lot of concerns about drug-drug interactions and can I really give Paxlovid? The data, and we've worked with Infectious Disease Society of America. I think we feel very comfortable, simple one-pager that we can get out to folks from IDSA showing that people can get Paxlovid under almost every circumstance. And given how powerful it is, people should be getting Paxlovid. We're doing anything we can to get those drugs out to the long-term care facilities and making sure that you have access. Last but not least is improving indoor air quality. This is something that doesn't get as much attention and is extraordinarily important. It turns out 90-95% of the transmission, maybe close to 100% of the transmission happens indoors, and it happens in places without great ventilation. And there is a lot we can do. Some things are very cheap and easy. Some things are expensive and complicated. But improving indoor air quality is extraordinarily important. You're probably going to have a lot of companies and vendors come to you with very fancy air ionizers. Most of those are unnecessary. We're talking about upgrades to the HVAC system. Often just getting your HVAC system a tune-up to get it working the way it was working. Portable air filters. Again, I'm not going to go through the whole list here, but the point is there's some simple things. I admit there's some things that are more complicated and difficult, but we really want to work with all of you to figure out how do you improve indoor air quality. Best data from the best experts suggests that if we do that, if we improve indoor air quality in places, we can cut infections by 30, 50, even 70%. Dramatic reductions. It's not COVID specific, it's not flu specific, it'll work for all respiratory pathogens. So the bottom line here is we've got an opportunity to have a very different winter. We've had 2 horrible winters. Lots of people have gotten very sick, and unfortunately a lot of people have died. This winter can be different if we work together. And again, GIF, I just want to say thank you for your partnership and leadership for AHCA, for letting us be a part of this effort. I'm confident if we work together on these issues, we can really make great progress. So thank you.
Well, thank you, Ashish, for your leadership and your guidance and really, as you say, the unwavering commitment to really cut through the barriers. And it's been a joy to work with you and your team, as well as the Secretary Becerra's team, too, on these issues. So thank you very much.
Thank you.